Hi, good morning, Magnus. My name is Mihiraa. Let's start the warm-up session. Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Which is your favorite destination? Why?
My dream destination is Australia. The first and foremost thing is that Australia has a world-class healthcare system, and I can be a part of it. Secondly, the country has a better standard of living and economic and political stability. Besides, here, nurses are paid well and respected too. In addition, I have many friends and relatives over there, so they can help me during my initial days.
Why did you choose OT?
It is my long-term ambition to work as a registered nurse in any English-speaking country, such as the UK, Ireland, and so on. To meet the requirements to register as a nursing professional there, I need to prove my English language proficiency. Hence, I chose OET to fulfill my dream. Moreover, OET is tailored according to the needs of nursing professionals. Therefore, I believe I could perform well in this test.
What are the current trends in your profession?
Nursing is a dynamic profession, and changes happen daily. Nowadays, technology plays a vital role in my profession. For instance, paper records that we used in the past have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in the present day, a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
Are you comfortable working with other doctors and nurses?
I find I work well under a variety of conditions and circumstances, and I take pride in my flexibility. I enjoy working in a team because I often find that different viewpoints can help me find solutions to a problem I might not think of on my own. I also enjoy self-motivating and am equally comfortable working alone.
Your preparation time is over. You can now start your role play.
Hello, good afternoon. I am Magnus Manschiffer, one of the nurses here at the clinic. It is wonderful to meet you today. What brings you into the clinic today?
Hi, Magnus. Well, I took a home pregnancy test yesterday, and it came back positive. I was really surprised because this wasn't planned at all. I guess I just came in to figure out what I need to do now.
I hear you. Finding out you are pregnant when you were not planning for it can certainly bring up a lot of thoughts. Well, before proceeding further, may I know your name, please?
My name is Mihiraa.
Mihiraa, how are you feeling about this news right now?
To be honest, I feel really happy and excited because I do want to be a mother, but at the same time, I feel completely overwhelmed and uncertain. It was so unexpected that my mind is racing about everything I need to prepare.
It is completely natural to feel a rush of mixed emotions right now, Mihiraa. Balancing genuine excitement with a sense of uncertainty is a remarkably standard human response when processing an unplanned pregnancy. So please give yourself all the space and time you truly need to let this important news sink in. You do not have to figure every detail out today, and you certainly do not have to navigate this significant life transition alone. We are fully committed to offering you warm, compassionate personal care and continuous medical support every single step of the way, ensuring that you feel guided, heard, and deeply cared for wherever this personal journey leads. To help us take the absolute best care of your overall health and personal well-being moving forward, we can walk through a few simple, routine clinical steps together today. First, we will perform a quick clinical urine or blood pregnancy test here at the health clinic to officially confirm the pregnancy. After that, we will estimate your gestational age by looking at the first day of your last menstrual period. Finally, we will review your complete medical history and any current medications you are taking to make sure everything remains completely safe, well-managed, and tailored directly to your individual health needs. How does all of that sound to you?
Yes, that makes sense. I definitely want to confirm everything officially and make sure any medications I'm currently on won't cause any harm.
That is great to hear, Mihiraa. Now, let us talk about some essential daily habits, starting with dietary and lifestyle adjustments to keep you healthy. Mihiraa, taking care of yourself right now is one of the most loving things you can do, and it is completely normal if these new adjustments feel a bit overwhelming at first. When it comes to your daily meals, a few gentle shifts will help keep both you and your body protected. It is best to step away from raw or undercooked foods, including sushi, runny eggs, and soft, unpasteurized cheeses, while also avoiding high-mercury fish like shark or swordfish. Keeping a thoughtful limit on your daily caffeine will also make a wonderful difference. On the lifestyle side, completely setting aside alcohol and smoking is essential for your well-being. At the same time, staying gently active with safe, low-impact movements like walking or prenatal yoga can work wonders for your energy and peace of mind. Just remember to always pause and check with a doctor or pharmacist before taking any over-the-counter medications, no matter how routine they might seem. You are doing an incredible job navigating all of this, so please take a deep breath and tell me how you are feeling about these changes, or if there are any other worries sitting on your heart today.
I think I can manage those dietary changes, though cutting back on coffee might be a challenge. My main concern right now is how to navigate all the decisions I need to make in these coming weeks, especially with telling my family and figuring out where I will receive care.
Mihiraa, navigating the early days of pregnancy can feel like stepping into a whole new world, often bringing a mix of deep reflection and quiet overwhelm. It is completely natural to feel uncertain about what comes next, but remember that you do not have to figure everything out all at once. Taking a gentle step back to discuss your thoughts, hopes, and feelings with your partner or a trusted family member can create a grounding space of support. Having these heartfelt conversations allows you to explore your options together at a comfortable pace. To help you feel more informed and confident, engaging with clear, evidence-based reading materials on early pregnancy care can offer valuable clarity on what your body is experiencing. When you feel ready, connecting with local antenatal clinics or maternity services is a wonderful next step. Healthcare professionals are there to offer warm, non-judgmental guidance, answer your questions, and ensure you receive the personalized care and resources that best serve you and your journey ahead. You are fully supported every step of the way.
Thank you so much, Magnus. Having everything mapped out step by step makes me feel much more confident and supported about moving forward.
To summarize our discussion today, Mihiraa, you came in after taking a positive home pregnancy test following an unplanned pregnancy, feeling a mix of genuine excitement and understandable overwhelm. We reassured you that these mixed emotions are completely normal and promised our full medical and personal support moving forward. We mapped out our immediate clinical steps, officially confirming the pregnancy with a clinic test, estimating your gestational age using your last menstrual period, and carefully reviewing your medical history and medications for safety. We also covered essential lifestyle guidance, including dietary precautions, avoiding raw/undercooked foods, soft unpasteurized cheeses, and high-mercury fish, while limiting caffeine, stopping alcohol and smoking, staying gently active with low-impact exercise, and checking before taking any over-the-counter medications. Finally, to help with your next decisions, we discussed sharing the news with your partner or family, providing educational reading materials, and connecting you with local antenatal clinics and maternity services whenever you are ready. How does this summary feel to you? And is there anything else you would like to discuss before we move on to your test today?
That summary covers everything perfectly, Magnus. It really puts my mind at ease having all of this laid out so clearly. I feel much more prepared now.
Good to hear, Mihiraa.